Alzheimer's is one type of dementia. So dementia overall is a combination of both memory loss and loss of one other neurological function. And it can be something as simple as agnosia, the inability to recognize normal objects. So maybe forgetting, for instance, what this pen is, maybe not knowing the difference between a fork and a spoon, but also the accompanying memory loss that we tend to always think of when we think of dementia. So dementia is not amnesia. Amnesia is memory loss. Dementia is memory loss plus some other loss of function. At first, they have some insight into it, yes. So they're usually very high functioning folks. You know, they're retired bankers, they're retired lawyers, they're retired doctors, they're husbands, they're wives, and they start to notice that they're not operating on the same level they used to. Overall, that insight is lost, though. So once they get into the moderate to severe levels of dementia, they don't have insight into the fact that they're losing their memory. In fact, they start to confabulate in order to make up for their memory losses, and they also can get very defensive about their memory losses.
Confabulate, what is that?
They make things up. So if you ask a really moderately to severe demented patient who the president is, when they're mild, they'll say, you know, I forgot the president. When they're moderate to severe, they'll say, I never liked politics in the first place, so don't ask me about politics. So as opposed to saying, I don't know who the president is, they'll get defensive and confabulate, maybe say things that are a deflection from the fact that they don't know. Yeah, probably the main area of focus is these amyloid plaques. So we know in Alzheimer's disease there's a lot of amyloid plaques that are abnormal when they develop. We don't know why they develop, but we know how they develop. So the overwhelming amount of research in Alzheimer's disease is either eliminating the plaques once they're already formed or trying to prevent the plaques from being formed in the first place. So these plaques that are in the brain are not supposed to be there, and they're sludgy. They really slow the brain down, and they progress. So at first it might just be in the temporal lobes of the brain, but it can progress so that the whole brain becomes riddled with these beta amyloid plaques. So most of the research is preventing those plaques via stopping certain enzymes, or maybe even removing those plaques, maybe through antibodies or other sources. We don't know. There's lots of theories on that. Some are environmental. So some people have theories that they might be pesticides. They might be heavy metals that make the body form these plaques. There's other theories saying that it's genetic. So some say you're born with this genetic predisposition to Alzheimer's disease. Some say you develop it through exposure to environmental toxins. The reality is it might be somewhere in between. You might be genetically predisposed to having Alzheimer's disease, and then some type of environmental insult can push it over. Our body is a collection of organ systems, you know. So the lungs or the respiratory system is an organ system. The heart and arteries and veins are the circulatory system. Well, we have a neurological system as well, and it's the brain and the spine and the nerves. And when a person starts to unfold, it might be their circulatory system that goes first, i.e. a heart attack. It might be their respiratory system that goes, i.e. COPD or pneumonias and cancers of the lung, or it might be their brain, you know. And when it's their brain, it can be Alzheimer's disease and amongst some other types of neurodegenerative disorders. So we are working on a couple different things. One of them is looking at the behavioral problems that occur with Alzheimer's disease. So for whatever reason, we know that 1/4 of patients with Alzheimer's disease in the moderate stages can develop psychosis. They can have false beliefs. They can even hallucinate. More commonly, those are visual hallucinations than they are auditory. So obviously, as a psychiatrist, a lot of my research is geared towards looking at the auditory, the visual hallucinations that occur, the delusions that occur. Neurologists and other researchers are looking at the cognitive aspect of Alzheimer's disease, and that is the memory loss. So looking at preventing cognitive decline over years. So if you can capture a person in the mild stages of Alzheimer's disease, we're not too bad at preventing it from getting worse. But if you capture them in the moderate to severe stages, we're not good at all at getting them back to where they used to be. So the hope is to develop a cure, if you will, so to stop the progression from going any further at all, and also hopefully someday to even get some of that cognitive ability back. Yeah, clinically we're not quite there yet as ease of use, but from a research standpoint, we certainly have been able to recognize that certain chromosomes and certain alleles on those chromosomes suggest that we have a marker to identify people who may be predisposed to Alzheimer's disease. Clinically, we're not quite there yet in terms of I can't just send a person down the road for a quick lab test to see if he or she has those alleles. It's possible, but usually they have to go far away to a big university setting, and it's kind of a complicated process. We do have a radiological marker out of the University of Pittsburgh, which we can administer to somebody and see if they have the plaques in the brains going on and help us identify it even earlier. Alzheimer's is a tough disease because right now it's mostly just a clinical exam where we identify it. There's not a real specific marker for it. You know, there's not a specific lab test that we can draw just to see if the person is suffering from Alzheimer's disease. So for instance, say something simple like a urinary tract infection is kind of simple in a way. We get a urinalysis, and if there's bacteria and there's white cells in the urine and leukocyte esterase accompanied by burning, on urination, then we know we have a UTI. Alzheimer's disease, it's a clinical exam. I sit and I talk to a patient, and I look at their memory scores, and then I have to come up with my diagnosis that way. There's not a real specific, easily obtained lab or radiological imaging right now. They do exist, they're just not readily available. On the behavioral side of things, for me, we have an inverse agonist at this receptor called the serotonin 2A, and there's a couple companies looking at those, looking at helping prevent the psychosis and the hallucinations that occur inside Alzheimer's disease. On the cognitive side, it's the different entities looking at ways to remove the plaques. So, Biogen has a drug that they're looking at that can help remove these plaques. So that's where we're hoping to go. I've seen drug studies where we have antibodies actually that can go in and locate the plaques and remove the antibodies. Remove the plaques, not the antibodies. The antibodies remove the plaques. So if we keep attacking this disease from both the behavioral symptoms and the cognitive symptoms, I think we'll meet in the middle somewhere. One thing that will happen is Alzheimer's disease is going to double in my lifetime as a clinician, unless of course we find a cure. And a cure would come in the form of either genetic editing. Genetic editing would be great. We're not quite there yet, but theoretically it's there. And stem cell research. So if we can find a cure for Alzheimer's disease via stem cell research or genetic editing, then we can stop this horrific disease. If we don't stop it, it's going to double in my lifetime as a clinician, so we're going to have to keep treating these symptoms. Friends, I've seen friends pass as a result. So it's on that side, it's always more troubling because you feel it subjectively. As a physician, you have unconditional positive regard for your patients, but you don't always feel it emotionally as much as when you see it happen to a family member or a friend of a family member. I think the thing that I always try to educate is the fact that it's not just memory loss. It's loss of another functioning, right? So if it was just memory loss, we could call it amnesia, and we could probably almost live with it, if you will. But it's the other problems that come with it. So it's when an Alzheimer's patient develops delusions, hallucinations, and psychosis that they become very difficult to manage. When they start making false accusations, when they start wandering the streets, when they start becoming a suicide risk, when they start falling, right? They fall and hit their heads. And so memory loss in and of itself, we could still take care of these folks at home. It's when they start walking away from the home because they believe their neighbors are in cahoots against them that they end up in nursing homes and assisted living facilities. I've seen some some horrific outcomes. I've seen patients die. That one patient in particular was a very outstanding member of the community, and got up, decided to walk down the street, and walked into traffic. Didn't get hit by the car, but trying to miss the car, hit their head on the concrete and died. And so it's just sad, because that's you know, it's the person's legacy and their posterity. They're usually very, very, very high functioning folks, and they aspire to stay as high functioning folks, but their brain starts to degenerate, and it's a hard way to watch them go. Yes, I mean, there's definitely some countries where we see less of it, and we're studying them extensively. I think Greece is one of them, and so we're trying to see what they're doing there. That's different. Again, it could be genetics, or it could be environment, though. Is there something in their genetics that prevent Alzheimer's disease? Or is it something they're doing in their environment? Are they eating certain foods that are antioxidants, per se? We do know for certain that the best thing for Alzheimer's disease is to be a very healthy human being. So use your brain a lot, use it like a muscle. If you use a muscle a lot, it stays strong and healthy. Brain's the same thing. You know, not having diabetes or controlling your diabetes, not smoking, eating diet rich in antioxidants, exercising, conversing, you know, having conversations with colleagues and friends, reading a lot, doing memory puzzles. Those things are outstanding for your brain, and they'll help keep you sharp. They can't stave off Alzheimer's disease. If you're predisposed and your destiny is to get Alzheimer's disease, being very, very healthy can push it off and prevent the severity, but you can still end up getting it. You know, through my work at Newport Bay Hospital, I see such a need, especially as our population is getting older. Right now in that hospital, I have 36 patients suffering from dementia, and it's not the memory problems that has landed them in the hospital. It's the falls, it's the walking down the streets, it's the delusions, it's the depression, it's the hallucinations, it's the not eating. One of my patients just went on a hunger strike for some reason, and she's actually stuck to it. It's all the other manifestations of the disease. The root cause is the Alzheimer's disease, but it's not the memory problems why I'm hospitalizing them. It's the other reasons. Yeah, there can be. They're most definitely interconnected. That goes all the way back to when we were little kids. Remember when we were little kids and we're worried about going to school? We legitimately feel a stomach ache. Like we're not making it up. We have a stomach ache, but we're actually anxious about going to school for the first day. The brain and the GI tract are most definitely connected. In fact, 90% of the serotonin in our body is in our GI tract. The other 10% is in our central nervous system. So they're most definitely connected. Yes. Yeah, so you're seeing imbalances in their neurotransmitters. So it's a neurodegenerative disease. Certain areas of the brain will start to degenerate for whatever reason, and that the focus of the neurodegeneration will get bigger and bigger and bigger. That's why the disease progresses and progresses and progresses. And as that is occurring, you can have alterations in, say, acetylcholine and dopamine and serotonin. And the imbalance is really the problem. And so we try to fix that imbalance through different mechanisms. Just do a nice memory screening exam. And there's different ones out there. It can't hurt. It's non-invasive. A memory screen is easy to do, and it's not invasive, so it's readily available for most every physician I know. Yeah, I think all specialties now are trained in how to test for the memory screening. Not all physicians are necessarily comfortable diagnosing Alzheimer's disease, but they can see the first signals of it, and when they first see the first signals, then they can refer you to a neurologist or a psychiatrist who's specializing in that.